Good morning. My name is Christine Landerholm. I am one of 3 point-of-care coordinators that work under laboratory services to help ensure that regulations are met with regards to point-of-care testing that's done by nursing staff at the patient bedside. Welcome to the point-of-care testing orientation. This is the first part of a 2-part series for your certification and training for running glucose by the Accu-Check Inform 2 meter. The first part is the didactic session. In addition to this video presentation, you will also need to perform a direct observation with one of the point-of-care coordinators or a nursing educator in order to sign off on your manual skills. So we'll begin with the didactic session. Our objectives are that by the end of this session, you'll be able to explain the role of point-of-care testing. You'll be able to perform QC testing and patient testing on the Inform 2 glucose meter. You'll be able to state when to perform QC tests. You'll be able to describe when and how you need to repeat tests. You'll understand the use of the procedure error comment, and you'll be able to explain when and how to disinfect these meters. We'll start with the definition of point-of-care testing. It is any laboratory testing that's done outside of the 4 walls of the physical laboratory. So this will be your at or near patient bedside testing. When you're performing point-of-care testing, you're performing the work of a medical laboratory scientist. Therefore, that aspect of your work falls under the jurisdiction of the regulatory agencies that oversee laboratory medicine. These will include JCO, CMS, and the Washington State Department of Health. We like to take the highest standard from any one of our regulatory agencies and apply them to our policies and procedures. That way we ensure that we are turning out high quality, accurate test results because we know that patient care decisions are going to be made based on these test results. The rules for point-of-care testing are that all testing is done under the lab's CLIA license. CLIA stands for Clinical Laboratory Improvement Amendment. It is a federal law that was passed in 1988 to oversee all laboratory testing. It ensures that basic patient safety standards are met in the course of all phases of testing. The testing has to be authorized by the lab's medical director, and here in our facility we have a full-time pathologist on staff that oversees all of laboratory medicine, including point-of-care testing. Users must be trained and certified, and that's what we are doing here today is your initial training and certification for glucose testing by the Inform 2 meter. In addition to your initial training and certification, you have to maintain competency annually. What that will look like is once a year you'll have to attend a health stream module. You'll have to complete a health stream module and pass the test. In addition to the health stream, you'll be required to run 2 levels of quality control on the meter within 1 year of your certification expiration. And what will happen is when it's within 30 days of your certificate expiring, when you scan the meter, a pop-up message will appear on the screen that tells you your certification is going to expire in X number of days. You need to run the quality control. You need to run 2 levels of quality control every year in order to maintain your competency. I always recommend to users that the first time you see that message pop up, run the QC. It may be several weeks before you have a patient that needs glucose testing again, and if your certification has lapsed, you will not have access to patient testing. You will continue to have access to QC testing for 30 days past your expiration. But if you don't run the QC, you won't have access to patient testing when you need to run it. And it's not an immediate process. Once you run the QC, it actually can take up to 30 minutes. You have to download the meter into the base. It uploads that information into our software and then sends it back down, the recertification down to the meters, and that takes some time. So please, the first time that you see that message pop up, just run the QC. That way you'll be ready to use the meter when you need to use it. In addition to your annual competency, all departments have to participate satisfactorily in proficiency testing. What this means is about 3 times a year we'll come around to the nursing units with unknown samples. These are sent to us by outside testing agencies, and even our department does not know what the true test result is. So we'll bring them to you, ask you to treat it like a patient sample and run the test. We submit it and are expected to obtain 100% on our proficiency testing. Anything less than 100%, then we're required to come back and do retraining and retesting with those users. I'll start with the number that you will use for your operator ID. We call it the badge ID number. So on the back of your badge, right above the magnetic strip, there's a 6-digit ID number. That is your badge number. It corresponds with the UPC barcode on your badge. This is the only number that you can use for point of care testing. Keep in mind it is different from your employee ID number. Typically your employee ID number will start with a 4 or a 5. Your badge number usually starts with an 8 or a 9. So make sure that you record on your checklist when we do our direct observations your badge ID number. If you are a traveler or a student, your number may start, you may only have a 5-digit number that's preceded with a letter T. Well, you'll not be able to scan that badge. You'll have to manually enter your user ID number, and you replace the T with a 0. So we'll go on to the instrument itself. In our hospital, we use the Roche Accucheck Inform 2 glucose meter. We do over 200,000 patient tests a year with this meter. This test is performed in all departments except by nursing, except in surgery, where it's just the anesthesiologists and the anesthesia techs that perform testing. And in the emergency department, the ED techs also perform testing. So the meter does not have any complicated moving parts to it, but it is a complex chemistry analyzer and computer processor, so it needs to be handled delicately. Never drop the meter or toss it onto a flat surface. As a matter of fact, if the meter gets dropped from any significant height, anything above an inch or more, you actually should run quality control testing on it before you continue to perform patient testing. The parts of the meter that you need to be aware of are the test strip port, which is at the top, and it is the little slit where the test strip, the reagent test strip, gets inserted. It's very important to ensure that this test strip port remains dry at all times. If it becomes contaminated with any fluid, such as QC solution, blood, or cleaning solution, it can ruin the instrument, and these instruments cost $700 a piece. So just an FYI, in the last month we've taken about 4 of these meters out of service because they've either been contaminated with blood or QC solution. So do your best to ensure that that test strip port remains dry at all times. Just below the test strip port is a scanning window. This scanner works best if the barcode is held about 6 inches away from the scanning window. And keep in mind, you need to make sure that the bars on the barcode that you're scanning are perpendicular to the scanning window. That's the only way to scan. The front of the instrument, you will see a touchscreen display pad. When you turn it on, it will display the main menu where you can access QC testing, patient testing, or a review of the results. Just below that touchscreen display pad is a little button that's sort of raised. This is your on-off button. It's used to turn the instrument on and turn the meter off. It is also used to reset the meter. To reset the meter, you press and hold the on-off button for 20 seconds. And I always recommend 20 seconds by the clock. I've held it down for 17 seconds before and it has not reset. Once you start to press and hold this button, you will hear a beep at approximately 5 to 6 seconds. That beep just indicates that it is putting the meter into a sleep mode. It does not indicate that the meter has been reset, so don't let go of the button when you hear the beep. Keep holding it down for a full 20 seconds. You will know if the meter has reset itself because when it comes back on, it will prompt you to enter the date and time because that information gets wiped out when you reset the meter. You will want to reset the meter if it's not doing what you expect it to do at any point. So if you pick it up and it won't turn on, or the screen appears to be frozen, or it has a funny error message on it, your very first step in troubleshooting should be to press and hold that on-off button for 20 seconds to reset the meter. If you go to dock the meter and it will not get into its docking screen, reset the meter. It needs to be in its docking screen in order for it to charge properly. So it never hurts to reset the meter. You can reset it as often as you need to. It's like your computer. Every once in a while, the computer processor just needs a reboot. So reset it at any time if it's not doing what you expect it to do. On the back of the meter, you'll see two metal contacts. This is where the meter makes a contact with the base to recharge the battery. This is really important to make sure that these metal contacts remain dry when you redock the instrument. If there's any moisture on the battery contacts, a rust film can develop and the contacts can start to corrode. And the rust film will actually prevent the battery from recharging correctly. So just make sure that you dry off those battery contacts anytime before you redock the instrument. These meters have a rechargeable battery. For that reason, they need to be stored in their recharging base. That's how the battery gets recharged. The number one problem we have with the meters is they don't get docked correctly and the battery gets drained, and then the instrument is not ready for use when you need to use it. So make sure that you dock it correctly and observe that the screen indicates that it is in its proper docking mode, and that will ensure you that it's being recharged. The instrument has a reading range of 10 to 600 milligrams per deciliter. It requires a small sample size of 0.6 microliters per deciliter. I always like to stop at this point and ask the group if they have a visual image of what 0.6 microliters looks like. So I'm just going to tell you it is smaller than a pinhead. So you should never be putting a full drop on the reagent test strip. That's a sure way of possibly contaminating that test strip port. So keep in mind your dose size is smaller than a pinhead, 0.6 microliters. We have a quick reaction time to your result. Should take less than 5 seconds for the instrument to show you the result. We have wireless transmission of the results here to the patient's chart in Epic. We also have it wired through the base. There are a couple of units where the wireless transmission can be a little bit spotty. So if your wireless is not working well, you can always dock it and that will transmit the results through the network. These instruments need to be disinfected with the Santa Claus bleach germicidal wipes, which I'm just going to reach for. The wipes in the tub with the orange lid. We require the use of the bleach wipes in our facility because this is shared medical equipment that goes from one patient room to the next, and our facility being an inpatient facility, we often have to deal with C. difficile infections. So bleach is the only disinfecting agent that effectively kills C. difficile spores. For that reason, we require the use of bleach on these instruments in order to ensure we're not transmitting C. diff spores from one patient room to the next. The base unit has two functions. It recharges the meter's battery pack, so there'll be a power cord that plugs into an electrical outlet. In addition, it can transmit data through the network, so it will also have an Ethernet cord that will plug into an Ethernet port in the wall. You see the little metal battery contacts there. That's how it recharges. These go in and out. But every once in a while they can get pressed into the base. If that happens, give us a call because we can troubleshoot it and help pop them back out. There is a light down here in the lower right hand corner that should always be on if the base is plugged in correctly. That indicates that there's power and it can recharge the meter. If the light is green, it indicates that it is connected correctly to the network and your data is being transmitted. If the light is red, either solid red or blinking red, it indicates that there is some issue with the data transmission. If you see a base with a red light, whether it's solid or flashing, you should reset the base. The easiest way to do that is to just unplug the power cord from the wall and then plug it back in again. When you do that, the light will go solid red for about 1 minute and then should switch to green. If you have tried to troubleshoot it and you still have a red light, you should call our office so that we can come up and do additional troubleshooting on the base unit. There is a certain display that must be observed when you dock the meter into the base correctly to indicate that it is docked correctly and it is recharging. So how do you know if your meter is recharging correctly? You are going to see this display. There'll be a tab in the upper left-hand corner that says docked. There'll be a large battery icon in the center. The color of the battery icon may be green, yellow, or red. Green indicates that there is enough of a charge in the battery that you can run a test, either a QC test or a patient test if needed. If the color of the battery is yellow or red, it indicates that there is not enough of a charge to even run one test. So you could pick it up and turn it on. It might let you scan a couple of things, but then it will shut itself off automatically because there's not enough power to run a test. So if you see the battery icon is yellow or red, you should leave it in the base. It takes 1 hour for the battery to become fully charged so that you can run a test. In addition, there's a little tiny battery icon in the lower right-hand corner. It should have a lightning bolt going through it. That lightning bolt indicates that it is docked correctly and is charging. If the battery is completely discharged, you might see a battery icon in the center with no color in it. It'll just be a big empty red battery icon that indicates the battery is completely dead. You need to dock it and make sure that you get the lightning bolt going through it. That indicates that it's charging. Again, 1 hour for a dead battery or partially dead battery to fully recharge. So when you dock these instruments, do not walk away from it until you see that it is in this docking screen. That way you know the battery is charging and it will be ready for use when someone needs to use it. So it's, as I mentioned, the number one problem we have with the meters, they do not get docked correctly and the battery goes dead. Then when you have a patient that is crashing and you need to check their blood sugar right away, you will not have an instrument that is ready for use. So do yourselves and your coworkers a favor, don't walk away from the meter until you see that the meter is docked correctly and is recharging. Okay, once the meter is docked correctly and recharging, the screen will go black after 2 minutes. This is a energy conservation mode. And you can tell if it's docked correctly, if it's sitting here with a black screen, by just tapping the screen. If you tap the screen or press the on-off button, the display should light up and show you that large battery icon that indicates it's docked correctly and charging. If you tap the screen and nothing happens, it remains black, that indicates it's not docked correctly. So you should pick it up and redock it. Sometimes you have to jiggle it around a little bit, redock it a couple of times, try it in another base. Sometimes they get particular about which base they can connect in correctly. So just don't walk away from it until you know that it's docked. These battery contacts, when they get cleaned, the bleach residue can leave a fine powdery film on them, and sometimes that prevents a good contact from being made. So you can take an alcohol prep pad and rub it on the battery contacts, both on the meter and on the base, to remove the bleach residue, and make sure you dry it, redock it, and that 90% of the time will improve the connection. Okay, we're going to move on to the reagents now. We consider the test strips the reagent because that's where the magic chemistry takes place. So there's a chemical reaction that will occur when the reagent in the test strip makes contact with either patient blood or the QC solution. These you can obtain from distribution. They are stocked in-house 24/7. In most of the units, they're either stored in the Pyxis rooms or the clean supply rooms. If you happen to run out, call distribution. They can tube them up to you. They come in a box that looks like this. When you open a brand new box, there'll be a little code key chip that looks like this, similar to what people put in their home meters. You can just throw this away because we code all of the information in through the software. So when you receive a new vial of test strips, or if you open a new vial of test strips, the very first thing that you're going to do is run quality control on your test strips. This is how we check our reagent to make sure that the reagent is performing correctly and giving us accurate test results. Once you've performed QC, and you need to run both levels of QC, you need to document that you've run QC by writing QC check on the lid of the vial. This way, anybody that grabs that vial of test strips to run a patient test knows that QC has been done and these are safe to use on patients. This is a GNO checklist item, and it's something we monitor closely in our facility. I will audit all of the totes a couple of times a year to make sure that this QC check documentation is done. We had a sister hospital in Oregon that underwent a GNO inspection several years ago, and they were cited numerous deficiencies because they had multiple nursing units that did not have documentation of QC being run on the test strips that they were using to do patient tests. So very first thing you're going to do when you open a new vial of test strips is run QC and document it. The strips need to be stored in their original container until they are all used up. You never want to take a couple of strips from one container if you're just down to the last two and put them in a new container. They are all coded specifically to the lot number for that vial, so make sure you don't take them from one vial and transfer them to another. So they need to be stored in their original vial with the lid snapped on tight, and it has a loud snap so that you know it's on tight. The reagent is sensitive to light and humidity, so the chemical will start to degrade once the strip is removed from the vial. For that reason, you need to leave the strip in the vial until you're prompted by the meter to insert the strip. And the strips themselves, I'll show you what they look like. They look like this. They're completely laminated, so you can handle them with your gloved hands. You'll have gloved hands, of course, when you're doing this. You can handle them anyway. It's not going to hurt the strip because they're laminated all the way to the end with plastic. But keep in mind, because they are laminated, you could put a drop of QC solution or a drop of blood the size of a pea on the top of this strip, and it will never get to the testing area, and it will likely contaminate the test strip port because it's laminated with plastic. So the only way to dose these is to touch the front edge of the strip to the QC bottle or to the drop of blood on the patient's finger, the front edge after the strip is inserted in the meter. That's the only way to dose these. The strip goes, the letters are going to be facing up towards you. The gold chip and the black arrows go into the meter, and then that gray square with the yellow rectangle is where you dose it. I always recommend anytime you have a strip in the meter, keep the meter horizontal. That reduces the likelihood that you might contaminate the test strip port if you hold it vertically or even diagonally. So that's what the strips look like. Whoops.
Wait.
Oh, okay. So the test strips will be inserted into the meter prior to dosing. Wait until you see the strip icon showing you insert into the meter before you take the strip out of the vial. And then you need to wait for a blood drop icon to appear before you dose the strip. You're going to apply the sample to the front edge of the strip, as I mentioned. I call it the KISS technique. So tip to tip, the front edge of the strip to the tip of the bottle or to the drop on the finger. And if you insert the strip into the meter too soon or you dose it too soon, you will get one of two error codes. The meter may tell you that you have a type bad dose or a strip defect error. If that happens, you can just remove that strip and throw it away. You can put a new strip in, wait for the drop icon to appear before you dose it. This way you don't have to rescan everything that you've done. This could happen with either QC testing or patient testing if you try to dose it too soon or if you try to insert the strip too soon. Now we will cover the quality control solutions. So in the tote there'll be two little bottles of quality control solutions. We run a high and a low. Gray cap is the low, white cap is the high. The low will say number 1 on it, the high will say number 2 on it. These quality control solutions are run on every meter every 24 hours, and this is how we check the instrument to make sure the instrument is functioning correctly and giving you accurate test results. The instruments have 24-hour QC lockout, so if QC has not been performed on that instrument in over 24 hours, you won't be able to run a patient test until you run QC first. It's everyone's responsibility to run QC. On some of the nursing units, it's a part of the workflow to have the HUC run daily QC on the instruments, but all nursing staff needs to know it's also your responsibility to run QC. If the meter hasn't had QC run on it in over 24 hours, or if you open a new vial of test strips, it's your responsibility to run the appropriate QC before you perform patient testing. That way you can have a high degree of confidence that your test results are accurate. So the times when you run QC, again, every 24 hours on every meter. Every time you open a new vial of test strips, and document it by writing QC check on the lid of the strip. If you come across a vial of test strips that have the lid off or ajar, you may run QC on those strips, and if they pass, snap the lid down and you can continue to use them. If it fails QC, you have to toss the entire vial of test strips. And then a couple of times a year, we end up with a new lot of test strips before the old lot is all used up. So what may happen is you may end up, because there are spots for 2 vials of strips to be stored in the totes, you may end up with an old lot and a new lot in your tote. If someone picks up the old lot to run the meter QC, the meter will record that, but you pick up a new lot to run a patient test, you scan that strip vial, the meter's going to tell you that it hasn't had QC run on it. So if you feel like you're running an extraordinary amount of QC, which you probably are going to feel like you run anyway, but a really extraordinary amount of QC, check to make sure that you don't have 2 lot numbers in your tote. If you do, the easiest way to get around this is to just take one of the vials out and stick it up on the shelf, so you've only got 1 lot number in the tote at a time until you use all those up. The QC solutions have an open vial expiration date of 90 days. The manufacturer produces these little tiny bottles with super slick plastic labels that you cannot write on with anything. Plus, they provide a microscopic spot for you to record the expiration date. So, to do everyone a favor, the point of care office labels the vials with the 90-day open vial expiration date with this bright orange label, and we distribute these to all the nursing units every 90 days. It's very important before you run a QC test to check the expiration date on your bottles to make sure that they have not expired. This is also a JCO checklist item. You cannot use expired control solutions to run your controls, so make sure you check these to ensure that they are in date. Because these bottles are little, it's easy to lose them. Sometimes they get thrown in the garbage by accident. I always recommend after you run the QC that you store them in the tote, put them right back in the tote where they belong. If they get thrown out by accident, call our office. You have to call our office to get new controls so we can make sure they have the correct expiration date on them. Now, our office is open Monday through Friday, 7:30 a.m. to 4 o'clock in the afternoon. So if outside of those hours you need to obtain additional control solutions, you can call the main laboratory. They have a supply of appropriately labeled control bottles in the main laboratory. They also have a spare instrument in the main laboratory in case your instrument gets broken. So you can obtain both a spare instrument or control solutions from the main laboratory 24/7 if our office is closed. So I'm going to demonstrate running the quality control solutions for you. And then this will be a part of your direct observation that we'll do at a later date. So to run QC solution, you're going to turn the instrument on by hitting that on-off button. It's going to go through a couple of windows, and then it's going to ask you for your operator ID. The way that it asks you for your operator ID is this little black tab says operator ID, and you see the scan button there. You can also manually enter it. So I'm going to scan my badge. Tap that scan button and scan your badge. The main menu pops up and you'll have access to patient test, control test, or review results. We're going to hit the control test button, and then it's going to take you to control test. It wants us to scan the control bottle. You don't need to select level 1 or level 2. These buttons are just telling you that these both need to be run right now. When you scan the bottle, it's going to know if it's level 1 or level 2. So I'm going to scan the level 1. I always, after I scan it, I hold the bottle in my hand because I have set the bottle down before and accidentally picked up the other bottle to run QC, and then surprise, you get a QC failure. So whatever you need to do, I always keep it in my hand because it's tiny and I can still do things with that hand. Then it's going to ask you to scan the strip file. You're going to scan the strips. It has to perform a code key check. And then you'll see the icon of the strip going into the instrument. When you see that, you'll know that it's time to take your strip out. And you can insert the strip, gold chip in, letters facing up. It has to read the code key on the chip once it's inserted. And then you'll see an icon of a drop going onto the strip. You know it's time that you can dose it. So again, you want to make sure that you hold the meter horizontal when you're dosing. I just make sure that I've got a little bit of solution in the tip of the bottle, and it's going to be that KISS technique, tip to tip. It will wick in that 0.6 microliter. And then I'm going to take the strip out because I always take the strip out before I hold the meter up. Then it's going to give you the result. On the floors, right. So when you're on the floor, once you've run the QC, it will just say pass or fail. When you're running your direct observation with us, it's actually going to give you a numeric value, and we're going to ask you to record that on your checklist. So when your QC has passed, you can hit the green check mark, and then you'll have to do the second QC level. So that's how you run QC. Now when we do our direct observations, we're going to require that you run both levels of the QC. You'll receive a numeric value and you'll record that on your checklist with us. All right. If when you're running QC on the floor, you get a QC failure, first thing, check to make sure that you dosed it with the correct bottle. When you've scanned the bottle, right at the top of the screen, it will tell you control L1 or L2. So that will indicate to you which bottle you scanned, just in case you forgot which bottle you scanned. And then if you see that you dosed it with the wrong bottle, there's a little comment bubble button down here in the lower left-hand corner. You can tap that comment button and a list of comments will pop up, and one of the comments is that you used the wrong QC bottle. It says wrong control used. So if you realize that you dosed it with the wrong bottle, just attach that wrong control used to the result, and then we'll know that you used the wrong control and you can repeat the controls. So make sure that both of your controls pass before the instrument is allowed for patient use. If you get one QC failure and you know that you've dosed it correctly, you can repeat the QC test. if it passes, it's okay to use the instrument for patient testing. But if you have a QC failure twice, you need to take the instrument out of use and call our office so that we can do troubleshooting on that instrument. All right, so now we're going to move on to patient testing. And just because I think that some HUCs may be accessing this video for their training in addition, patient testing is only performed by RNs, certified medical assistants, and ED techs. So if you are a HUC, you are allowed to do QC testing, but not patient testing. All right, so moving on to patient testing, the first consideration that we make in patient testing is whether or not it's appropriate to do finger stick testing on your patient. In our facility, we have one restriction against finger stick testing, and that is that patients who have impaired peripheral circulation should not have finger stick testing done. We feel that it may be difficult to reach the capillary bed, and also that the capillary blood is not going to be very representative of the peripheral circulation. So don't perform finger stick testing or capillary testing on patients with impaired peripheral circulation. This is going to include patients that have severe dehydration, hypovolemic shock, they have significant peripheral edema, or if they are on induced hypothermia protocols, you don't want to do capillary testing on them. Now you can still use the glucose meter on those patients. You just need to make sure that your sample type is either a venipuncture or a line draw. So for all practical purposes, since you don't have a mechanism of getting a drop of blood out of a venipuncture tube, you can use a line drawn sample on patients that have impaired peripheral circulation. With one caveat, make sure when you get that sample of blood in the syringe that you do not put your finger on the plunger. In the last month, I took 2 meters out of service because they had been dosed with line drawn samples and the blood had been squirted right straight into that test strip port. So if you get your line drawn sample, you're going to make sure, of course, that you've appropriately cleared the line, and then use a piece of gauze to expel a drop of blood from the syringe. Just make sure that you have got a little bit of blood in the tip of the syringe, and then keeping your fingers on the sides of the syringe, you're just going to kiss the end of that syringe to the end of the strip to do your dosing. All right, so keep your thumb off of the plunger. All right, that is the restriction against capillary testing. Now there are a number of restrictions or interferences that will render the glucose result inaccurate if it's run on the meter. These interferences are all listed on a sticker that's on the front of the meter tote, so you don't have to memorize them. I'm going to go over what they are for you. If your patient has a hematocrit less than 10 or greater than 65, if they have triglycerides over 1,800 milligrams per deciliter, such as in acute pancreatitis, if your patient is receiving IV administration of ascorbic acid, or they have galactose levels greater than 15 milligrams per deciliter, and you can see that in hereditary galactosemia in neonates. These 4 conditions will cause an interference that will render the result on the glucose meter inaccurate. So if your patient has any one of those 4 conditions, you'll have to obtain a lab draw. We'll have it sent to the main laboratory where the big instrument can overcome all of those interferences. So again, the restrictions on use of the meter altogether are on the sticker, and also a reminder that you should not do finger stick testing on a patient that has impaired peripheral circulation. So for patient testing, a small amount of blood is required, same dose size, that's 0.6 microliters, so smaller than a pinhead. You can use venous, arterial, or capillary blood, either a finger stick or a neonatal heel stick. Those are the only 2 sticks that are approved by the FDA for use with this device. You cannot use an earlobe stick or a forearm stick, or a toe stick? Those are all questions that I've had in GNO. So just to clarify that, only a finger stick or a neonatal heel stick. You may not use umbilical cord blood. And then you also need to make sure that you wipe the first drop of blood away after you have lanced the patient. That first drop of blood will contain a higher proportion of tissue fluid, so you could get an inaccurately low test result. So for patient testing here, we train to preferentially use the third or fourth finger of the non-dominant hand. Then you could use the third or fourth finger of the dominant hand. You can use the fifth finger if it's not too small. You want to avoid the thumbs because they have a pulse of their own. Avoid the second finger because it has more nerve endings and it'll hurt a little bit more afterwards. Then you're going to use alcohol. All the supplies are located in the tote. You can use an alcohol prep pad once you've made your selection to clean the finger off. And most of these patients are frequently testing their fingers, so I always like to ask the patient which finger they would want me to use. You're going to clean the finger off with alcohol. Make sure you allow the alcohol to dry completely or wipe it dry with a piece of gauze. If the alcohol is wet on the finger when you lance it, it's going to lyse the red blood cells, and that can give you an inaccurate test result also. And then you're going to lance the patient on either the right or left curvature of the finger. I always train to face the finger, draw an imaginary clock face on it, and at either 10 or 2, just like you're supposed to put your hands on the steering wheel, that's where you're going to do your lancing. You don't want to lance in the center of the pad. You do not want to lance on the side of the finger, and never ever down near the joint where the ligaments and nerves run just under the skin. So the greater curvature of the finger. Our lancet devices in the totes look like this. They have an adjustable depth. So there are 3 depth markings. They are relative depth indicators on the side of the gray shaft. They come preset to the center. There's a purple arrow on that little cap that you can turn to either get a deeper lance or a more shallow lance. The lance depth that it comes set at is a 1.8 millimeter lance depth. If you twist it to the long mark, that will give you a 2.3 millimeter depth, and the short mark a 1.5 millimeter depth. You will know that the lance has not been used because the pin is stuck inside tightly. So if you pick one of these up and you find that the pin is loose or it's missing, make sure you throw it away, because of course these are single device only. And then when you've made your site selection, you've cleaned the skin off, allowed the alcohol to dry, what you're going to do is just twist this purple pin, remove it, it's ready for use. If you look on the end of the shaft, you'll see that it has an oval shape. So you want the longitudinal axis to be perpendicular to the fingerprint lines. And then these are not pressure activated, so you need to activate the trigger with your thumb. That will activate the lance. Wipe the first drop of blood away, and then you can use the second and subsequent drops for your specimen. Okay. The number that we use for patient testing is called the CSN number. It stands for Contingency Serial Number. Sometimes it's referred to as the FIN number or Financial ID number. It's a unique number that is assigned for each patient admission. It's different from the MRN number. The MRN number should remain the same for one patient across multiple admissions, but the CSN number will be new with each admission. This is the only number that you can use for point-of-care testing that will allow the test result to cross directly into the patient's chart in Epic. You are not allowed to manually enter patient ID, and that's a safety feature to prevent typographical error. When you scan the patient's armband, we have a safety feature with the meter. A pop-up display will appear on the screen that will show the patient's name and date of birth. This is a stop check for you as a nurse to ensure that you are performing the test on the correct patient. If this is not the patient that you're performing the test on, hit the red X and go back out and get the correct ID. I can tell you about once a month, we get a call from the Family Maternity Center asking us how we can get a glucose result out of the mom's chart because the test was actually run on the baby. So there's no excuse for it. When you scan mom's ID band, mom's name and date of birth will pop up on the screen. That's not the patient you're running the test on. Hit the red X and go back out, get the correct ID. We have a mechanism that will allow you to run a patient test in an emergency in case the patient doesn't have an armband yet or it won't scan for whatever reason. But please make sure that you look at the screen and ensure the name and date of birth displayed are the person that you're performing the test on in order to ensure that the result gets into the correct patient chart. So once you've verified that the name and date of birth are correct, you can hit the green check mark and proceed with testing. Now you may get a message that says the patient is not found and it just displays the CSN number. This occurs when the patient's registration process hasn't quite caught up to where their location is in Epic. So say for example you have a patient that's been in X-ray. They actually get a different CSN number assigned for their X-ray encounter. And so if Epic hasn't registered their change when they come back to the floor yet, when you scan the badge, it may show you that the patient is not found. It doesn't indicate that you've got the wrong ID. It just means you need to verify that the number displayed, the CSN number displayed on that message, matches the CSN number on the patient's armband. If they match, then you can hit the green check mark and proceed with testing. So either name and date of birth match or a CSN number match, but please use this pop-up screen, this safety feature, to ensure that you're performing the correct test on the correct patient before you hit the green check mark. Now, we do have a mechanism that will allow you to run a patient test in case a patient has an unscannable armband. It may be wet, it may be smeared, they may be in surgery with their arms tucked and draped and you can't access the armband. So inside the lid of the meter tote, we have what we call the emergency barcode. You can scan this barcode and it will give you access to perform a patient test on the meter. So you can use this if the patient has an unscannable armband, they don't have an armband yet. Also, you can use it on someone who is not a patient. So we frequently, probably 30% of the time, have an emergency glucose test run on a family member or a visitor or a coworker that is feeling lightheaded or they know that they're diabetic and they need to have their blood sugar checked. Please check it. We want to take care of each other regardless of whether or not you're a patient. So there are very specific instructions on this sticker as to what you need to do if you use the emergency barcode. Just running the test is not the end of it. You have to call our office, let us know you use the emergency barcode, give us the patient's name and date of birth, or let us know that it was a non-patient that you ran the test on. We need to know which instrument you used and the date and the time. If you have the CSN number and can give us that, that's great. If not, we can look it up with the information that you use. But regardless of whether you run the test with the emergency barcode on a patient or non-patient, you must call our office every time. The information is on the sticker. Our voicemail is password protected, so you can leave protected patient information 24/7 on our line. You can also send us an email with that patient information. But just make sure that you call us every time that is used. If you use the emergency barcode and you don't notify us, you'll get an email from us. Some people call them some people call them nastygrams, but I like to think of them as a love letter. We're just trying to help you do your job correctly and make sure that we're getting the correct results into the correct chart. So if you don't call us or leave us a message, you'll hear from us regardless, because we know everything that happens with these meters. All right? Okay, so patient test results will all cross into Epic and show up in the patient's chart. There is one comment that you can attach to a patient result that will keep the test result out of Epic. So if, for example, you realize that you ran the test on the wrong patient, or there was some kind of error code, or maybe the test result was not consistent with the patient's clinical picture and you want to recheck it, if you want to keep that result out of the patient's chart, you can attach the procedure error comment to it. So you need to attach comments before you accept your result. When the result value pops up on the screen, you'll have either the comment bubble that you can hit or the green check mark. Once you hit the green check mark, you've accepted the result and you can no longer attach a comment. So if you realize that you don't want that result going into the patient's chart, hit the bubble comment to get the comments up and then attach that procedure error comment to it. The other comments are merely communicative, so they can communicate maybe to somebody that's coming on shift after you or to the provider. They include things like use this result, or will order lab, or patient was symptomatic. The other comments will show up in Epic. Procedure error comment does not show up in Epic, it just keeps the result out of Epic. Now, times when you would want to repeat a test result: if you got an error code when you were running the test, you want to repeat it. Also, if instead of a numeric value you got low or high, you'll need to repeat the test on the meter. Or if the result doesn't match the clinical presentation, repeat it on the meter. You want to do all repeats within 10 minutes. That prevents a duplicate financial charge being assessed to the patient. Again, a reminder, the reportable range is 10 to 600 milligrams per deciliter. So if you get a low as a result, that indicates your patient's blood sugar is less than 10. Repeat it on the meter. If you still get a low, then you're going to treat that patient right away. If you get a high, that indicates the glucose is greater than 600 milligrams per deciliter. Repeat it on the meter. If you get a high again, you're going to need to know what the glucose value is so you know how to dose your insulin. So for that reason, you're going to have to order a lab glucose test. The order that you want to put in is called a glucose recheck. That indicates it's a recheck of the meter value. It will not generate a new financial charge to the patient. It'll be a stat draw and will be hand carried to the lab, handed directly to the chemist, and put into a manual spin and write on the instrument. If you order a random glucose, it will generate another financial charge to the patient. It'll be a routine draw, could get tubed to the laboratory and go on the chemistry automation line, so it could take 3 to 4 times as long to get your test result. So make sure if you get a high and you repeat it and you get another high, you put in an order for glucose recheck, and you do need to order that yourself. The meter doesn't automatically order it if it gets the high value. Our critical values here: you need to follow nursing protocol for patient treatment and provider notification, and make sure that you are documenting your provider notification in Epic. It's not required that you repeat the test if you get a critical value, but it is required that you notify the provider and document that. For infants which are less than 1 year of age, the critical low is less than 45, the critical high greater than 150. Everyone else 1 year of age or older, the critical low is less than 50, the critical high greater than 500. Again, I went over the comments, so once you get your patient test result, you can attach a comment if you need to, use procedure error comment if you want to keep it out of the patient's chart, and the other comments are not required, but you can just use it to communicate with someone. So now I'm going to demonstrate running a patient test. First of all, I'm going to make sure that the patient does not have impaired peripheral circulation. So fingertips are pink and evenly pink. If they're pink and mottled, or if they're any color other than pink, that indicates some degree of impaired peripheral circulation. You're not going to do testing. So these fingertips are pink and evenly pink. So I'm going to say it's okay to do patient testing on this patient. You're going to turn the instrument on, and you are going to scan your badge. And you can also manually enter your badge ID if you memorize it. Say you're in an isolation room and you don't want to have to access your badge underneath your gown. If you memorize your badge ID, you can manually enter it. So now we're going to select patient test, and the first thing it asks for is patient ID. I have a fake patient ID band here, so I'm going to scan this, and it's going to give me the message that the patient is not found because this is a fake patient. But the CSN number is displayed there. I'm going to check to make sure that this number on the display matches the number on my armband. Remember, you could see this message in real life if the patient has recently been registered into Epic or has gone in between units. So when I've verified that the number matches the number on the armband, I'm going to hit the green check mark, and then it's going to ask me to scan the strip vial. We'll scan that, and then you're going to get the little icon of the strip going in there. So now I'm going to put the strip in, and then you're going to do obtain your patient sample. So you're going to alcohol the finger, dry it or let it dry. This one, well, you saw me pull the pin out. I'm just using this as a demonstration. Of course, you're going to have gloved hands. You're going to make sure that that longitudinal axis is perpendicular to the fingerprint lines, and then you're going to lance. You're going to wipe away the first drop of blood, and then you can use the second and subsequent drops of blood for your patient test. I have a fake patient sample here. This is what you'll get during your direct observation to dose with. So again, I'm just going to make sure that I've got a little drop right on the end of the bottle and touch it to the strip and wait for my result. Notice that I am keeping that meter horizontal because there's a strip in there right now. And then I'm going to take this out before I tip it up. So look at that, my patient's glucose is 274, and it's flashing at me telling me that this is out of the normal range. So I'm going to go over here and hit that comment button, and I'm going to say that the patient was symptomatic. All right, and I'm going to hit the green check mark, and then you'll see your result with your comment underneath it, patient symptomatic. So hit the green check mark. Now that's going to go to the patient's chart in Epic, and that comment is going to be attached to it. So that's how you're going to do your patient test. And then we require that once the patient test is done, that you document that result manually in Epic under your flow sheet, vital signs flow sheet, using preliminary point of care glucose. The reason we require manual documentation of the result is because point of care testing allows you to test and treat at the bedside. You do not want to treat your patient unless you have documented need for treatment in Epic. When the result goes into this meter, it actually has to cross through 4 different softwares before it gets into Epic. So depending on the synchronization cycle of the software, it could take up to 30 minutes for your result to show up in Epic. So for that reason, we require that you manually document in Epic under your flow sheet using preliminary point of care glucose. So you've run your test, you've got your result, you've documented manually, you've treated your patient if your patient requires treatment, and now it is time to clean the meter. The meter gets cleaned after every patient test, regardless of whether or not there is a meter in every room for every patient. So, for example, in our intensive care units, each patient room has its own meter. That does not mean that you do not clean the meter after every patient test. Sometimes the meters don't communicate and we have to go up and do troubleshooting on them. I have frequently gone into the intensive care unit to troubleshoot a meter, picked it up with my ungloved hand to turn it over and see blood all over the sides and back of the meter. So the meters also get taken out of one room and put into another room on occasion. If it's not docked correctly and the battery is dead in one room, you'll go into the room next door to grab that meter to check the blood sugar if you need it. So even in the intensive care units, make sure that after every patient test, you clean the meter with the Santa Claus bleach germicidal wipes. So to clean them, you're just going to turn the meter off by hitting that on-off button. You're going to get one of your wipes, and if it's the last few wipes in the tub, they get a little juicy, so wring them out a little bit before you clean them. You're going to clean all surfaces, front, back, sides, top, and bottom. The bleach solution has a 4-minute contact time to kill C. diff spores. We do not expect you to stand there and hold it for 4 minutes while C. diff spores are getting killed. So you can redock it. Before you redock it, make sure that you dry off those metal battery contacts so that they're nice and dry when they go back into the dock, and that prevents a rust film from developing. Right, that's disinfecting the meter. Now, the third option that you have from the main menu is that you can review test results. This might be handy if, for example, you forgot what the actual value was before you manually documented in the patient's chart. You can go back to that meter and look up the test result. Review results will allow you to sort the results on that meter in between patient results and QC results, and then you can touch an individual line to get more information on that test result. We have resources that you can access if you need a refresher on how to perform the procedure or what our policies regarding testing are. On PolicyStat, which is now Media Lab, you can access the policy for Roche Accucheck Inform 2 glucose meter. We also have a point of care site on the Providence intranet that you can access by clicking to the laboratory department and then clicking to the point of care link. You can call our office if it is regular office hours, and our number is located on every tote. I always recommend, if you need help with troubleshooting, and we are in Monday through Friday, 7:30 to 4 o'clock, call us. That's the fastest way for you to get troubleshooting help. In addition, you can access Accucheck, Roche Accucheck Inform 2 customer care hotline 24/7. All right, so you're almost done. What will happen next is there'll be time for you to do a direct observation with someone from our office or someone from the nursing education office. You'll have to check off everything on your checklist and take the quiz. And then in addition, you'll have to do a direct observation with your manager up on the floor. And then you'll be all checked out and ready to use the glucose meter for testing on your patients. If you have problems accessing the meter or have any questions or concerns about troubleshooting or the policy itself, please give our office a call. We are here to help you be able to do your job as efficiently as possible so that you can take the great care of our patients that we know you're going to provide. So welcome to Providence, and please make sure you reach out to our office if you need any help. Thank you.